And we're going to move now to the fight against the pandemic. And more than 150 employees of Houston Methodist Hospital have either resigned or have been fired after refusing to get the COVID-19 vaccine. Earlier this month, the hospital system suspended 178 employees for 2 weeks without pay for not complying with regulations that they be vaccinated against the coronavirus. In response, 117 employees filed a lawsuit over the requirement, but it was later thrown out by a federal judge. Houston Methodist was one of the nation's first health systems to impose a vaccine mandate, but more have followed suit, including the majority of hospitals in Washington, D.C., and Maryland.
Elizabeth, 95% of doctors, based on the surveys I've seen, have taken the vaccine. For some reason, a lot of healthcare workers don't, and it's not just in this Houston hospital. I mean, this is happening across America.
It's a lot of places, and it's just there's a lot of reasons why they won't. They feel it's my body. You can't tell me what to do. It's an emergency authorization vaccine, so therefore they're worried that it was developed too quickly. There's a lot of different reasons why they're saying they don't want it, but it seems like a basic requirement that if you're going to work in healthcare, you're going to be dealing with people who have COVID,
healthcare provider,
that you would perhaps want to be vaccinated. But it just shows you how politicized this vaccine is still, and how people do not have all the facts about it.
Yeah.
It was fascinating. You know, Anthony Fauci was going door to door this weekend in Washington, this past weekend, knocking on doors, trying to convince people to get the vaccine. We reported that this morning. He spent 90 minutes in Anacostia talking to people on their front porches, and in 90 minutes he said 6 to 10 people to get vaccinated, but promising, $51 gift certificate, perhaps you could win a Jeep and a raffle, and he got some people down to get vaccinated, but it's a very, very slow process. The point is there is still an enormous amount of hesitancy about this vaccine, but there shouldn't be in hospitals.
Willie, we don't want to send our loved ones, we don't want to go hospitals being treated by people who aren't vaccinated. I don't want to even be in a grocery store with people who aren't vaccinated. But there is this resistance, which, okay, if there's personal resistance, people have their reasons. We live in a free country. I understand that. What I don't understand, though, are leaders that have pushed back so hard against the ideas of, like, vaccine passports. People suggesting that somehow this is Big Brother when all of our children have to have, quote, vaccine passports, or they don't get to start kindergarten. And they haven't been able to do that for, 50 years? This is nothing new.
It's nothing new, and there is that fascinating split that you pointed to, which is that the American Medical Association says 96% of doctors have at least one shot. But there was a survey from Kaiser back in March that showed only 52% of frontline workers, nurses, people working in the hospitals, healthcare workers, have it. And part of the hesitancy was that it was new, that it was untested, that it didn't have full FDA approval. And that was the argument some of those nurses made in this case that they lost, now that a lot of them have been let go. But you're right. It feels like we've bumped up against a ceiling here. The White House yesterday announced it's not going to reach the 70% vaccination goal that it had set for the 4th of July. It just couldn't be any easier, frankly, to get it. They've done everything they could. The states have done everything they could. They're giving away cars. They're giving away $1 million lotteries. It's all there for the taking, but the fact remains there's a certain percentage of the American population that flatly is not going to get vaccinated, even as this Delta variant moves in, and has a lot of healthcare experts very concerned for the places where the vaccination rates are so low.
Right, and I have people saying, well, it's not approved by the FDA yet. Why is it not approved by the FDA yet? Well, there's a process.
I was in Geneva a couple of weeks ago interviewing the guy who runs Gavi, which is the key part of COVAX, the effort to vaccinate the world. And it's just, for them, it's so galling for them to hear people in the US, healthcare workers, rejecting the vaccine. They can't get vaccine for elderly, vulnerable healthcare workers in a lot of these developing countries. And the problem, we're not out of the woods yet here. I mean, if this virus rips through the developing world, we're going to see more and more mutations, and these variants are going to come back here to America. And if we have a significant unvaccinated population, I mean, they may evade the vaccines that we have already. So it's a real problem. It's a real big problem. And, you know, you're bribing people now and they're not taking it. So I don't know where you go from there. I mean,
that has to be so maddening
it's galling.
For people in countries that can't even get a vaccine.
For all those countries that we're giving vaccines to, that was just announced by the White House, right? That they're looking at us and they're saying, "Wait, I don't understand why
you don't want this."
Right? Like we will take we'll take yours, exactly, and that's what you keep hearing.
All right, still ahead on Morning Joe. More on New York City's mayoral race. Our next guest says there are national implications to the vote. We'll explain what those are. Plus, what's next for voting rights after yesterday's Republican filibuster in the Senate? And on infrastructure, the co-chairs of the House Problem Solvers Caucus join us here to discuss where their bipartisan plan stands. Also ahead, violent crime on the rise across the country, and local leaders see few options for regaining control. And as we mentioned, new reporting this morning about former President Trump's efforts to get Saturday Night Live to stop mocking him by getting the Justice Department involved.
Can we get in on that?
No, you're watching Morning Joe. We'll be right back.
Got my spine.